Hi, I'm Dr. Shweta Dulip. I'm an aesthetic physician practicing in Dubai. And just to introduce you off to this audiocast that I've decided to get started on with, this is an amazing start to a couple of episodes discussing with my colleagues in the industry, as well as my clients, who have different perspectives on anything within the industry and without. We all come from different schools of thought, and we have different insights and experience and educational backgrounds. And this is just my little way of accumulating and picking everyone's brain into figuring out how we go from the beginning of a consultation to the end of a procedure, how we plan our outcomes, and more importantly, who we are as people, what our education, what our backgrounds say about our practice, and what school of thought do we bank on when we come to making these decisions. So for today's episode, the introductory episode, I've invited one of my very dearest friends and colleague, Dr. Mayur, who is a dermatologist and an excellent aesthetic provider by profession. And with him, I want to start off the introductory episode discussing our inspirations, our dreams, and the reason why we got into doing what we love doing the most. So hi, Dr. Mayur.
Hi, I'm Dr. Mayur Bhobe. I'm a specialist dermatologist. I've been practicing in Dubai since the past 6 years, and I'm glad to be here.
How good to have you. This is our first episode, and I would not think of anyone but bringing you onto the episode because we work at the same place, and I always look at you when I have to discuss dermatology cases. So tell me, what did you think of starting? How did you get started into the business?
I don't think it was intentional, but I remember watching these beauty pageants back when I was a child, and there was this dermatologist, Jamna Pai, who used to always come dressed in a white suit, and she was so glamorous, and she spoke about skincare and other things. So I thought about it as a profession back then, but I forgot about it a long time after that. But I think I developed an interest in dermatology per se when I looked at some clinical cases during my internship. And when I moved to Dubai, the entire focus has kind of shifted into aesthetics. So it was not intentional to be in aesthetics.
Okay, brilliant. But out of both of them, what would you say you enjoy doing more?
I think both have their pros and cons. While aesthetics might give you a instant gratification, but it comes with its own set of problems as well. So I think a bit of both, because nothing is as rewarding as well than to treat a life-threatening dermatological disease.
Absolutely. Actually, for me, it's a very interesting story how I got started. I was practicing trauma medicine, which, if you think about it, the spectrum, it was emergency medicine. And compared to what I'm doing today, which is very elective medicine, over there, my patients needed me. I had to step in and make decisions on their behalf. Over here, in the role that I'm doing right now, my patients don't technically need me. I'm there to fulfill something which they want, and it's not emergency, as it is something that they could do on another day. So I always like that contrast. But like you said, I mean, clinical always is more gratifying to treat, but aesthetic also, I feel, it's nice because you make someone feel better about the way they look.
Yeah.
That way what we do is sort of good work. Yeah?
Yes.
So what do you enjoy doing most then in aesthetic medicine?
I think Botox.
Yeah, absolutely.
Yeah. It's simple and very less complications and good results.
Good results, quick results.
Yeah.
I feel it's a great thing to start someone off
and it's
with.
reproducible.
As in, you mean the results can
Results are reproducible.
Results are reproducible. I always ask most of my colleagues, what is that one procedure you started off the first time you did for yourself and you felt, wow, this is amazing? What was that for you?
Again, Botox. I think it's almost the only thing that I have been religiously doing.
Really?
Yeah.
Okay, that's a good thing. It's the same for me. I got it done, I think, for headaches, maybe in 2016 for the first time. And it really was great for the migraines, for headaches. And I've never skipped since then. So one of the best things about working in the UAE is we have such a mixed group of clientele who walk in through our door every day, talking about different cultures and ethnicities and mixed race. So I think there's a bit of challenge in that as well, which is great. I love that because you get a different perspective, a new face every day.
I think being here in UAE, we are exposed to so many different cultures and nationalities, and the idea of beauty and the facts with respect to aesthetics, they're so completely different when it comes to different races. So we are constantly learning from people and adjusting to new ideas of beauty.
Absolutely. And I think that comes from years of experience and interactions and procedures that we do, that we learn and unlearn and relearn these things over years. So tell me, the thing is, our industry is so new and we're still setting the foundations of such a young industry. The aesthetic medicine, I don't think, has been around for more than 50 odd years. And so there are so many gray areas and so many ethical and moral dilemmas about what we do, especially for someone who's very new to the industry. These are boundaries they set. What is your take on this?
Yes, absolutely. There is always an ethical dilemma. I have been asked about why am I propagating procedures which would affect the self-esteem of someone. I've been also accused of body shaming. But when I talk about procedures or advise procedures to someone, it's just to make them aware of all the options that are available, to make them look more confident, feel more confident. And they should be aware of all the things that they can do to feel more confident.
Absolutely. I think the information that's there out there, there's so much information. There's overexposure, overstimulation, and sometimes too much information can be a bad thing because you need to really weed out and get reliable sources. And, education, the client education and consultations are a big part of that. So sometimes for me, I take multiple consultations, long consultations, to even come to the final outcome, which is a procedure. That really helps me to align with the client expectations and, have a direct understanding of what they want and whether I can provide it to them.
Yes, I think I have learned the importance of effective communication and setting boundaries with the patient after really years of experience, and I continue to learn until today.
Brilliant. On another discussion, let's do a rapid fire to as a get to know you quickly, yeah? If you weren't doing what you were doing, what would you be doing?
I think I would have been doing psychiatry.
Psychiatry?
Yeah.
What about if not a doctor?
I think maybe I would be in aviation.
Aviation, so like a pilot?
Maybe, yes.
A pilot? Oh, good. They make a great pilot.
Or maybe it's crew. I don't know.
Okay, cool. All right, brilliant. What is your comfort food? What do you like to eat that puts you in a good mood no matter what?
Acai. I love acai.
Acai? Oh, interesting. Oh, I didn't know that about you. Okay, perfect. What are you watching on Netflix now?
I'm watching this Indian movie called Chor Nikal Ke Bhaga.
Brilliant. And what are your thoughts on it?
It's very nice. You must watch it.
Really? Okay, perfect. It's thrilling.
Yeah.
I can't do thriller movies because of the build-up music, I think. It's just, anyway. You're very interesting that way because psychiatry is a bit core practice of what we do right now. At least that's what I believe.
Okay.
So I think a good understanding of the human psyche is very important for doing what we're doing right now. Because body dysmorphia is on the rise. And it's important for us to understand exactly what the signs are of body dysmorphia to be able to pick that out and counsel the clients better to make better choices for themselves. So to wrap this up, I'd like to ask you, would you recommend your career and your career choice to another future colleague on the rise? And what are the pitfalls? How would you set them up for all the good and the bad and the ugly of our industry?
Yes, I would recommend it. The person has to be really interested in it. I would like to tell them that it's not as glamorous as it seems. There's a lot of hard work which goes into it. Not just in terms of studying, going through med school, but also you need to really work upon yourself, your networking skills, your communication skills, which is quite challenging, and you need a lot of patience to sit and understand the patient's expectations. And some can be really difficult. So effective communication is a learned skill.
Absolutely. Additionally, I think it's also important to really love beauty in every sense, to find and see beauty and to give it the importance that you should.
And as practitioners in what we do, we elevate the beauty of already beautiful things.
That's beautiful. That's a very nice way to end things. Thank you for being here.
Thank you for having me.
So, if you enjoyed this episode of the Audiocast, and if there's anything else that you'd like me and my colleagues to discuss and give more information on, please let us know in the comments. And I'll see you soon in a new episode with a new colleague and with our thoughts on a new matter. Thank you.